Hi, my name is Brandon Roth. I'm with the Miles City Community College Nursing Department. Today we are going to do our third video for the IV return, and we are going to do from an IV line to an IV lock to be able to later administer medication. First thing we're going to do is we're going to make sure that we have our orders from our doctor, which we do. We have our orders, we have our MAR, we're gonna verify everything. We will come back to our orders in a minute. We're gonna go into the patient's room, we're gonna perform hand hygiene and place on gloves. I'm going to ask the patient for 2 identifiers. He will then, or she will, give me her name and date of birth, and I'll verify that with our electronic records. I'm going to explain to the patient that we are going to check on the Luer lock. We're going to make sure that everything in our IV is proper, that we don't have any infusion outside of the IV, but that everything is still in there. What we want to do is to remove the main line. We're going to make sure that it is shut off. We're going to take an alcohol swab. I'm just going to pretend because we are down to hardly any. We're going to come in, we're going to clean off the Luer lock system. Going to train the patient how to make sure that if this is in place, that they will be able to continue to keep it clean and sterile for future use. We are going to flush it with, as part of the cleaning, is we're going to flush it, we're going to wipe that off again. We're going to put our saline on and do a 5 milliliter flush with our 0.9% normal saline. Now we are going to document that that was done, and we are going to get rid of the supply trash that we have. Now we are going to go back to our physician's order. This is where we are going to administer 2 milligrams IVSP of Dilaudid. The important thing with Dilaudid is that we are going to, for every milligram that we use, we are going to use a diluent of 2 milliliters, or milligrams, I'm sorry. So we are going to end up drawing up. I'm going to get our medication ready. We will use a syringe that has a Luer lock system as well. We're going to apply our needle. We're going to apply our needle. We're going to take a alcohol swab. We're going to clean off both of our diluent and our medication. We are now going to add our air for 2 milligrams. And because we need the diluent, we're going to need 4 milligrams of the diluent. Which gives us a total of 6. We're now going to safely recap, and remove our needle. We're now going to come back over. We will take another alcohol swab. We'll go ahead and clean our port, even though we had done that earlier. Now, one thing that is important is that we are going to, before we administer, we are going to flush another 5 milliliters. Once we do that, I'm going to re-wipe it with alcohol swab just to be safe. We now have our medication. Now, what's important about this medication is that we administer it over 2 minutes. So it'll be a fairly slow process of administering. Once we finish that administration, we're going to take off our syringe and we are going to flush it once again with another 5 milliliters of saline. Okay. Now we have administered and we have flushed. We're going to get rid of our things. Of our garbage. We're going to get rid of our sharps. Those are going to go into a sharps container. Now we have an order to remove the IV catheter itself. So we are going to begin by taking off our tape. Because I did not consider this at a different time, we will actually have performed hand hygiene again and donned on a new pair of gloves just to make sure. We've loosened our tape. We want to loosen the clear film. Sometimes you may need a little solution to get it to loosen up. We're holding our skin. We don't want to hurt our patient. We're going to pull this back. We're going to pull this was our chevron lock. We want to make sure we have that unsecured as well. We also are going to have some gauze. And now that we have everything loosened, we will actually fold this gauze over. We will pull out. And we are going to check the tip of our catheter to make sure that nothing was left in there. And we will dispose of that as well. We're going to apply pressure here for a few minutes. And then we can, if necessary, we can have the patient hold it, or we can apply some tape to hold that pressure down to make sure that there is no bleeding afterwards. And now we're going to make sure everything is okay with our patient, and then we're going to document the procedures which we did, and that concludes our IV return.